Thank you so much, Dr. Caleb. Oh my gosh, we're coming on the Saturday morning at 8 a.m. preparing for this video. I really appreciate you.
Yeah, no problem.
Yes, coming
Absolutely.
the day that you're off. So today we're coming in here is, as a massage therapist, I see a lot of clients coming in pain, especially chronically. And then I know we wanted to creating this resource page for people can be able to learn from other health practitioners rather than just receiving the massage, because we wanted them to getting better overall from the whole body perspective, right? So, and I'm so glad that we can be able to collaborate together. So now, before we're starting our like home exercise or strengthening training or anything like that, we wanted to go over some questions so that people can understand a little bit more about PT, so that they can be able to see. There are a lot of times that when clients come in, I don't think a PT works, but for me, PT is really working, helping you. Because of that, I was like, oh, I need to have an interview first before we're working it.
Absolutely.
Yes.
Sounds good.
Okay, so the first one that I'm asking you is, in simple terms, what does the physical therapy and what is the physical therapy, and then how is it different from massage and chiropractor?
Sure. So, in simple terms, the thing that a physical therapist is going to utilize and believe in more than anything is going to be exercise, which is probably why a lot of people don't think PT works, is because they don't like exercise. Exercise can be pretty difficult. Exercise over a long term helps change the tissue. We will absolutely use soft tissue techniques and joint mobilizations and all kinds of fun stuff like that to help kind of jumpstart and possibly reduce some pain. We'll do some other pain modulation techniques, but in the long term, we're doing a lot of exercise to help improve function and change the tissue tolerance and all that kind of fun stuff.
That's awesome. I'm glad that we can be able to go over that.
Yeah.
So now, at what point someone should come in to see PT instead of doing stretches at home, or getting massages, or working out improperly? I can't say working out improperly, but they think about the workout would help, but ending up they're getting hurt. So, like, at what point that people should come in to see you?
Sure. So there's a lot of reasons that people come to physical therapy. The number one reason is they are in pain.
Yes, you're right.
Typically people are not showing up saying, I have this poor movement pattern, or I feel like I bad posture, but they don't have any form of pain. Not to get too deep into it, but pain is your brain's perception of a threat, that something's going wrong in your body. So typically you go do something about that. You typically go to your doctor or massage therapist, something like that, or to a physical therapist and say, hey, my ankle's hurting, my low back's hurting, something's going on. Can you help me reduce this pain? And in doing that, we help people get back to their lives and function and exercise, go back to the gym without pain, or do, just kind of everyday life that can be pretty painful. So that's the main reason. Sometimes, stretching or massage or things like that aren't enough because the tissues that are painful just need some exercise. They need to be loaded properly so that they can begin to heal and get out of the pain cycle that they are in.
I'm with you. I'm 100% with you. So whenever clients come in, they have they complain about that they have back pain. The front side is so tight. So it was like, okay, you need to strengthen on your back so you can be the back can be coming back. So it's going to be more well function economically, right? Or more like symmetrical.
Yeah.
So that you don't feel like fat pain, right? So so this is great.
Yeah.
So now I have a question. Why do so many people hurting, even they are doing stretchings and they do workouts, but they're still experiencing the pain?
Sure. Yeah. They can have very strong movement muscles. We call them like global muscles, like my quads might be very strong, but I'm having a lot of weakness in my hamstrings. You might have very strong lats, or some of the lumbar paraspinals might be very strong, but your transverse abdominis, some of the inner core muscles might just not be functioning properly. Some of the more common reasons is, especially for shoulder issues as well, we have weakness in your rotator cuff muscles, but the deltoid might be trying to pick up the slack, or your upper trap might be compensating for the weakness that you're having in the lower trap. Everyone loves to go to the gym, trying to put on muscle, and they'll do a bunch of shrugs and focus on their upper traps, but you got to show some love to the lower traps as well. It's the same muscle. So you'll have all types of compensatory patterns and poor movement patterns that develop. So people will be like, well, I go to the gym and I work out, but I'm still having pain. That might be one of the reasons that is going on.
You speak up to my mind right now, because whenever you talk about, oh my gosh, I see clients coming up all the time. They're so tight on the upper trap, and the lower part is kind of like a little bit weak, or glutes is weak, and then they have experienced a lot of pain. So I'm just so glad that we have this conversation. Yes, this
absolutely
is awesome.
Yeah.
Yes.
And speaking kind of to tightness, like if someone has a significant amount of tightness, like let's say in like the pec minor or something like that, bringing shoulders more forward, that will decrease the activation that they have in their lower traps and rhomboids, or if their hip flexors are very tight, it reduces the activation of the glutes. So things can kind of cascade if they are not getting some of those things addressed, and then they're trying to go, to the gym and hop in on heavy squats or something like that.
And then injury, right?
Yeah, so like those poor movement patterns can lead to problems down the road.
Yeah, 100%. Have another question, very commonly people are asking. So whenever in pain, is more tightness cause the pain, or is more weakness on the muscles cause the pain, or poor movements of the joints cause the pain?
I would definitely say that it could be one or the other, or all three.
Yes.
It just depends on the person. It depends on, I'll tell people this a lot. You are what you do. So if, you are doing the same movement pattern over and over and over again, it can create tightness in certain areas and create weakness in certain areas. It might just be the movement pattern itself. It's really hard to tell what is specifically causing pain until you dive in and do a more thorough examination and then kind of prescribe what is appropriate for that patient.
I'm with you. I'm 100% with you, for sure. So now I'm coming from the perspective talking about the posture. We did describing posture quite a bit in our previous video, but I have questions about to you is, how much does posture matters in preventing pain, and why isn't posture alone enough without the proper movements and strength training?
Yeah, I definitely think that posture is a part of preventing pain. Kind of like I was saying earlier, when you are what you do, well, if you sit for long periods of time in front of a computer hunched like this is kind of where you're going to live. And
like this.
So the importance is movement. The importance is getting up, moving around, changing those postures, taking your joints and your muscles through their full range of motion. That is where you can help prevent pain. So posture is definitely a component to it.
Gotcha. From a PT perspective, do you think massage does help support the physical therapy outcome?
Yeah, absolutely. Massage is incredibly beneficial. There's probably don't need to tell you this, but, for anybody who's watching, there's incredible benefit. Some of the things that I love and will recommend people to go for massage is to desensitize their nervous system. So some people have very hot, kind of active nervous systems. Massage can go in and reduce a lot of the tone in the musculature that's being attacked by that nervous system. People that have significant tightnesses in areas that the muscle just really needs to get stretched and mobilized, massage can be very beneficial. I can only do so much with exercise. Sometimes stuff just needs to get worked out, get loosened up. And so massage, especially honing in on some of those areas for prolonged periods of time, is incredibly beneficial. Brings tons of circulation, moves out all the all the byproducts of pain and tenderness and tightness in muscle. So all that's incredibly beneficial.
Yes, you have a strength training from the PT and then come here get a massage to loosen up.
Absolutely.
Go back again and come back right here, right?
Yep. Alongside, they can work very, very well hand in hand to reduce poor movement patterns and improve function and reduce pain.
Yeah, that's awesome. So now, what happens when people only treat the pain but not retrain the movements?
Yeah. So, if you are treating the pain, the analogy that I'll give is you're treating the symptoms and not the cause, So you're treating the cough, but not the cold. And sometimes it's those movement patterns, especially repetitive movement patterns, that will over time cause breakdown of the tissue, pain, dysfunction, all that stuff. So you have to retrain the movement patterns or make modifications, things like that. That is what long-term will reduce the pain and dysfunction.
Yeah, I'm with you 100%. So I always tell the clients, if you come in here just only wanting to relax in the muscle but not properly correcting, the pain's still gonna come back. We need to find out what caused the pain, right? I'm thinking about, instead of talking about posture is a component. Let's talk about the bad habits instead of focus on this. We're going to talk about the bad habits, how the bad habits can cause you pain. I think that's how the whole purpose coming in here, right? So let's forget about this. Now, this is going to be interesting part, right? So we come in here, a lot of time daily activities really the big components, right? To like repetitive range of motion, bad habits, or even sleeping pattern will impact you having pain, right? So now I'm coming from the perspective that clients coming in, they having a lot of pain, such as neck always forwarding, shoulder around it, or standing in the way that they have a hip tilt, right? So that causes a lot of pain. So let's talking about that. Why people sitting on a computer, hunch over, they were having pain in the back, but they don't feel too much on the front. Like not like pain in the front. I know that for me, I know the pain actually is coming from the front, it's too tight, holding the posture, right? But they're experiencing a lot of pain on the back. Why is that?
Well, that's a good question. It would depend on specifically what tissues the nociception of pain is coming from. A couple reasons might be when you're hunched forward, that's kind of where the load is happening, especially on the spine, some of these lower areas. So if you were to bring your shoulders back and move through those movements, you would decrease some of that load there. People spend a lot of time sitting, especially if that's their job. They sit, and they are looking at a computer, blah blah blah. Everyone knows kind of the typical positions that people wind up in. I've written letters to companies and stuff like that to try to get people into standing desks, because standing naturally puts you in a much better position. Not just to make people stand all day, because it's better and healthier for people to stand than it is for them to sit, but get those desks that go up and down, because sometimes it's being able to just change your posture periodically that's very important. Because if you're stuck in one position for a very long time, your body's going to let you know, and it'll let you know because it'll start experiencing that.
Oh yeah, for sure. Like sleeping pattern, right? So recently we do like SMP trackers, where that clients come in, they tell us what is their bad habits. Oh my gosh, sometimes we have like 10 clients, the whole entire staff, and you can see the patterns, like everybody's sleeping on their right side, or sleeping on the left. You can see all day, and then whenever they come in pain, everybody's in the same area, no matter which size of their body, no matter what is their gender, it doesn't matter. They're showing the pain at the same area, same problem, all across. Yes.
Yeah, I mean, with sleeping, so this is what's difficult, because a lot of people do have issues, especially with sleeping. Their pain can be reproduced because of some possible sleeping postures. Sleep's hard to change.
You can't change.
You kind of do what you're going to do at night. So sometimes like small little modifications can make a difference.
Oh yeah, a little bit more.
Yeah, so just, changing your pillow. And it's a hot topic. People sell all kinds of super expensive pillows and all this stuff. I've never really thought that is super necessary to go out and buy the $300 cervical pillow. Although I know PTs that swear by them. I think just having options. Kind of like we were talking about earlier, where it's like I can stand, I can sit at my desk. If that's what I need to do 8 hours a day, I would like to have options so that I can change my posture. Well, I would like to have different types of pillows to use. So ideally, would I want someone, laying down with a pillow that's, perfect for their height, so they can have their head, on the side, so they're not here, and they're, can hug like a body pillow with one leg up. That'd be amazing. But I've, had people do that, and they're like, yeah, I kick that thing off in the middle of the night, and I, wind up in whatever posture, on my stomach, I'll go like this, and it's just, it's those patterns are hard to change. So I think sometimes just giving people some different options, be like, hey, we'll try, a smaller pillow or a bigger pillow, or I've had people, take pictures of their setup and then like, well, let's just try a couple of these small modifications. Sometimes that can make a big difference. But again, sleeping's difficult to change. So.
Now I understand why the hotel always have so much pillows on their bed.
All different sizes, right? Yeah.
All different sizes.
Yeah.
I guess that's the big component, right?
Yeah, there's, and people like what they like. They'll get all different types of setups and stuff like that. So if you can find one that works well for you, I feel like the one that works well for you is probably the best.
Or all over.
Or all over, yeah.
Okay, so now let's dive into how can you help us to helping us load our muscles and correcting our tissues versus just the posture like that.
Doing some good positive movement.
Oh yeah.
There's a whole myriad of exercises that we'll do that can help for all different types of things. Do you want to go ahead and get into the list?
Let's do it. Yes, let's go.
All right.
Yes.